Hey everybody. So it's been a while since I've been on. Um, Nothing bad has happened. I did get my bone marrow biopsy results back in March. I guess it was March 13th. So I'll talk about those. Just had a lot going on, and we moved actually the beginning of April. We moved. So had lots of going on, packing, unpacking, cleaning, blah, blah, blah. Um, but I did want to get back to you on my bone marrow biopsy results. I've had a few people asking me on YouTube what's going on. So I thought I would do a quick video and talk about that. So I did get them, and everything appeared consistent with polycythemia vera. So the doctor didn't go in too much detail, and I actually have my son with me because the appointment was during March break, and my son is only 11. So and he doesn't know a whole lot. He knows mommy has something wrong with her blood, and he knows mom goes to the hospital and gets her blood checked and stuff like that. But he doesn't really know um, much else other than that. So I didn't really want to have the doctor go into too much detail when I was there about the actual bone marrow results. So I will likely at my next follow up, which is in June, ask to see an actual copy of the report and just see exactly what it said. But basically, she just summed it up and said, the results showed that your bone marrow is overproducing. You have hypercellular. You have a lot of blood cells, because it's not only my red blood cells that are high; it's my white blood cell count is elevated as well, which is pretty consistent with PV. So, and I actually also wanted to talk a little bit about my phlebotomies and how that's been going. So, I have my hematologist gave me, initially, she set up a weekly schedule for me to go. I think I mentioned that before in one of my other videos. And I did have the first one done the day after my bone marrow biopsy, which went well. But I've gone for consistent weekly blood draws, and my hematocrit and my hemoglobin have stayed below. Well, my hematocrit has stayed below 45. It's not much below 45, but it has stayed below 45. And so yeah, I haven't had to have any other phlebotomy since then. But I have still gone to get the weekly blood draws anyhow, because from what she explained to me, she wanted to get a good kind of baseline and see where my levels, are they consistently hovering right about around 45 below? Are they kind of fluctuating up and down? And they seem to be kind of stable around that level. So that's good as well. So yeah, like I really haven't had much else going on medically. I'm still waiting for my referral to see the hematologist that she put in for me, and she did say it would take a while. That he's always really booked up and he's quite busy. I look like hell right now, but whatever. um, so I'm still waiting to hear about that, and like I said before in my other videos, that's really my main. The PV was kind of an incidental finding. I mean, we certainly weren't looking for that. Um, I was more trying to get to the bottom of my pain that I've talked about in my previous videos. So I am still experiencing that pain on a regular basis, and then with moving and everything recently, and kind of all the physical, aspects of packing and cleaning, and don't get me wrong, my husband does help. I didn't do a lot of the like lifting and moving of stuff, but I mean, you're just packing and cleaning, that too is physical. And when you're hurting all the time, and you still got to go to work and you have two kids to take care of, like it's just a lot on the body. And I'm one of those people that I tend to preach at other people about, you need to take it easy and you need to rest. If your body's telling you to slow down, then slow down. Um, but I think as women, I don't know, we try to do it all, right? And, since we've moved, I've painted 3 rooms, and that means going up and down on a ladder, which it's hard because I'm in pain, and especially my feet these days. I don't know why my feet, but the bridge of my feet, my ankles and stuff. So going up and down a ladder is not good. Plus I get dizzy. So that's not a good combination. But I just got to get it done, right? Like I see these things that need to be done, and I my mind wants to do them, and my heart's in it. My body just can't, it's not capable of doing what I want it to do all the time. So um I think I'll take the weekend off. I've been painting for the last 2 weekends, so plus I still go to work. So it really only leaves me the weekend, and you're trying to cram everything you can into a weekend. And now that spring is here, I was out over the long weekend on Easter there. I was trying to get out and rake the lawn and tidy up the front yard and stuff like that. Because the weather was nice, and you gotta do what you can when you can get some nice weather. So anyhow, I think this weekend I may actually try and take a little break from that and give my body a break. But so as far as my health goes, that's kind of where I'm at. My next follow-up with the hematologist is in June, like I said. So um, I expect she'll probably just, do like a check-in and kind of talk about my blood results, and maybe talk about changing the frequency that I have to go have my blood checked. Maybe it'll be like, I don't know, once a month or something. But um, yeah, so that's where I'm at. I also wanted to mention and talk a little bit about kind of as I was describing what led up to my diagnosis, and I had mentioned things like, you know, being iron deficient and being hypothyroid and having the endometrial ablation done. I was thinking about it, and it's so ironic the way, your body kind of lets you know that something's going on, right? Like, thinking that the iron deficiency was just about the menstrual cycles, which it was. I mean, obviously my blood counts went the opposite direction after I had that done, but the irony of having the ablation done, the procedure to stop, the menstrual cycle, only to turn around and have to go to have bloodletting done manually. It's so ironic to me. I mean, I'm still glad I had it done, because had I not had it done, I may not have known about this for years, right? It's kind of like it unmasked this condition because my body was previously taking care of it the old-fashioned way, right? Like Mother Nature was doing her job. So I don't know, it's kind of ironic the way things work out, but nonetheless, at least, I know about it. And as far as my symptoms go, when it comes to PV, I mean, I don't have the itching, and after I like have a shower or bath, and I know that's pretty common um, for a lot of people with PV. I do get bouts of itchiness, but it's in my hands and my feet. But I just chalk that up to dry weather, like wintertime, especially, it's bad. But and it's that kind of itching where you itch and you feel like you're like there's something just crawling, like you want to just rip your skin off. That kind of itching. but then it'll pass. Like, it's not every day, it's not all the time, and it's not consistent with having like a hot shower or bath. And fatigue is another one that I have regularly, but again, like, I'm hypothyroid, and right now my B12 is well, it's been low. And my iron, is consistently in the lower end of the range. So those things can make you tired too. And, autoimmune diseases in general, fatigue. I mean, fatigue is such a common symptom among so many different disorders and things. So, you don't kind of think that it's something else going on. So maybe, I don't know, maybe it's one, maybe it's the other. And then joint pain. Joint pain is, it's not uncommon with people with hypothyroidism either. So that's kind of why I thought that my legs and my hips and all that pain, is it hypothyroidism or is it something else going on? And then when you learn that you have PV, and then you think, well, maybe that's causing it. But then the hematologist doesn't think that that's related, hence the referral to the rheumatologist again. I don't know. It's sometimes so frustrating because you feel like you've gone to a million doctors and you had a million tests. And I mean, other than this most recent finding of having PV, like, and the hypothyroidism, like, those things are so definite, right? Like, there's tests for that. And when it comes to other things, it's either hard for them to nail it down, or it's, you get misdiagnosed, or maybe it's, who knows, maybe it's something else, right? And you find like you have to go from doctor to doctor to doctor, and you have to ask for certain tests. But I have to say, even though it's been challenging, like, always push your doctors. If you know your body best, yes, we're not doctors, that's why we go to them, but challenge your doctors. Don't just accept necessarily everything that you hear that they tell you at face value. If you feel that there's something going on, or that that you're not getting the tests you need, or you generally just don't feel like the doctor's listening to you or taking you seriously, then push to see another doctor, push to get another referral, push to get those tests, because there's no way that people should have to go through this and suffer for years and years. I mean, as it is, it tends to take months. Just like, look at the position I'm in with this referral to a rheumatologist now. So, she actually said to me, it may be up to a year before you see him. He's that busy. That's crazy to me. But anyway, things are well other than that. And like I said, there's not much you can do, right? You just try and stay on the positive side. I'm glad my bone marrow biopsy didn't show that. Oh, by the way, she said that there was no fibrosis that they could see. She said it was a relatively small sample, but they didn't see any fibrosis, so that was a good thing. And yeah, nothing else that she mentioned to me at the time. So like I said, I'm going to ask her for more details and see the report. But anyway, I'm kind of jumping all over the place here, so I will probably cut it here and maybe do a couple more videos before I see the hematologist in June. And yeah, so that's it. Hope everyone's well. Take care. I'll see you next time. Bye for now.